Hello friends. Welcome back to my classes with a new topic, dysphagia. Today we are discussed about the dysphagia, types of dysphagia, causes of dysphagia, diagnostic evaluation and management of dysphagia. So let's start the lecture. Dysphagia. Dysphagia is a medical term that refers to difficulty or discomfort in swallowing. It can involve problems with any part of the swallowing process, from chewing food and moving it into the throat to the actual passage of food down the esophagus. Types of dysphagia. 1. Oropharyngeal dysphagia. This occurs when there are difficulties in the oral and pharyngeal phases of swallowing. It can result from neurological conditions, muscle weakness, or structural abnormalities affecting the mouth and throat. 2. Esophageal dysphagia. This type involves difficulties in the esophageal phase of swallowing, often due to issues with the esophagus itself. Causes may include strictures, inflammation, or motility disorders affecting the esophageal muscles. Causes of dysphagia. 1. Neurological causes. Conditions such as stroke, Parkinson's disease, or damage to the nervous system can disrupt the coordination of muscles involved in swallowing. 2. Structural causes. Tumors, strictures, or abnormalities in the structures of the mouth, throat, or esophagus can impede the smooth passage of food. 3. Muscular causes. Weakness or dysfunction in the muscles used for swallowing can lead to dysphagia. This can be related to conditions like muscular dystrophy or myasthenia gravis. 4. Gastroesophageal reflux disease, GERD, chronic acid reflux can cause irritation and inflammation in the esophagus, leading to dysphagia. 5. Achalasia, a disorder where the lower esophageal sphincter fails to relax, making it difficult for food to pass into the stomach. Understanding the type and cause of dysphagia is crucial for proper diagnosis and targeted treatment strategies. If you suspect you or someone else is experiencing dysphagia, it is essential to consult with a healthcare professional for a thorough evaluation. Clinical manifestations. Clinical manifestations of dysphagia, or difficulties in swallowing, can vary depending on the underlying cause and the specific phase of swallowing affected. Here are common clinical manifestations. 1. Difficulty initiating swallowing. Patients may struggle to start the swallowing process, leading to prolonged chewing or difficulty moving food from the mouth to the back of the throat. 2. Choking or coughing. Episodes of coughing or choking during or after swallowing, indicating that food or liquids may be entering the airway instead of the esophagus. 3. Regurgitation. Incomplete swallowing may result in the return of food or liquids back into the mouth after swallowing, often accompanied by a sensation of food sticking. 4. Aspiration. Inhaling food, liquids, or saliva into the airway instead of directing them into the esophagus can lead to respiratory issues, pneumonia, or recurrent lung infections. 5. Pain or discomfort. Pain during swallowing, which may be localized to the throat or chest, indicating structural issues, inflammation, or irritation. 6. Change in voice quality. Hoarseness or changes in voice quality may occur due to dysfunction in the muscles or structures involved in swallowing, affecting the larynx. 7. Weight loss and malnutrition. Persistent dysphagia can lead to reduced food intake, resulting in weight loss and nutritional deficiencies. 8. Fatigue during meals. Experiencing exhaustion while eating, particularly if swallowing is laborious or inefficient. 9. Avoidance of certain foods or textures. Individuals with dysphagia may avoid certain foods or textures that trigger difficulty in swallowing, leading to a limited and potentially inadequate diet. 10. Gurgling sounds. Audible sounds during or after swallowing, which may be indicative of difficulty in managing saliva or secretions. 11. Drooling. Difficulty in controlling saliva, leading to drooling, particularly in cases where the muscles responsible for swallowing are affected. It's important to note that these manifestations can vary in severity, and individuals experiencing persistent or worsening symptoms should seek medical evaluation. Diagnostic evaluation. The diagnostic evaluation of dysphagia involves a comprehensive assessment to identify the underlying cause and determine the most appropriate treatment. Here are key components of this evaluation. 1. Clinical history. Detailed questioning about the onset, duration, and progression of swallowing difficulties. Identification of associated symptoms like weight loss, coughing, or regurgitation. 2. Physical examination. Examination of the oral cavity, throat, and neck to identify structural abnormalities or signs of neurological issues. Assessment of overall health, including any signs of malnutrition. 3. Radiographic studies. Barium swallow test, contrast esophagography. The patient swallows a liquid containing barium, and X-rays are taken to visualize the passage of the barium through the esophagus, revealing structural abnormalities. Video fluoroscopy, real-time X-ray imaging of the swallowing process, providing detailed information on the coordination of the oral and pharyngeal phases. 4. Endoscopic procedures. Upper endoscopy, esophagogastroduodenoscopy, EGD, a flexible tube with a camera is inserted through the mouth to examine the esophagus, stomach, and upper part of the small intestine for abnormalities. Fiber optic endoscopic evaluation of swallowing, fees. An endoscope is passed through the nose to assess the swallowing process and detect any issues in the pharynx or larynx. 5. Manometry. Esophageal manometry measures the pressure and coordination of muscle contractions in the esophagus, helping identify motility disorders. 6. CT or MRI scans. Imaging studies may be used to identify structural abnormalities, tumors, or lesions affecting the swallowing organs. 7. Laboratory tests. Blood tests may be conducted to assess nutritional status and identify any underlying systemic conditions. 8. Neurological evaluation. Assessment of neurological function, especially in cases of suspected neuromuscular disorders contributing to dysphagia. The choice of diagnostic tests depends on the specific symptoms and suspected causes of dysphagia. Management of dysphagia. The management of dysphagia involves a multidisciplinary approach, addressing both the underlying causes and the challenges associated with swallowing difficulties. Here is an overview of various aspects of dysphagia management. 1. Pharmacological interventions. Medications may be prescribed to address specific causes of dysphagia, such as acid suppressants for gastroesophageal reflux disease, GERD-related dysphagia. Botulinum toxin injections to relax overactive muscles causing swallowing difficulties. Muscle relaxants or medications targeting neurological conditions, depending on the underlying cause. 2. Dietary management. Texture modification. Adjusting the consistency of food and liquids to make them safer for swallowing. Examples include thickening liquids or choosing soft, pureed, or chopped foods. Dietary changes. Altering the diet to avoid foods that are difficult to swallow. Ensuring a balanced and nutritious diet despite modifications. 3. Nursing interventions. Positioning. Proper positioning during meals, such as sitting upright, can help facilitate swallowing. Feeding assistance. Providing support and assistance during meals, including cues for safe swallowing techniques. Oral care. Maintaining good oral hygiene to prevent infections, especially in individuals with compromised swallowing abilities. 4. Speech and swallowing therapy. Speech-language pathologist, SLP. Conducting swallow assessments and designing individualized therapy plans. Providing exercises to improve muscle strength and coordination involved in swallowing. 5. Surgical interventions. The surgical intervention performed during the severe condition of dysphagia such as tumors, obstruction or in case of cancer. The surgical intervention performed as follow. Esophageal dilation. Widening a narrowed esophagus using a balloon or other techniques. Surgery to remove obstructions or tumors. Addressing structural issues causing dysphagia. Feeding tube placement. In severe cases, a feeding tube may be recommended to ensure adequate nutrition. 6. Follow-up and monitoring. Regular assessments to track progress and adjust interventions is needed. Collaboration between healthcare professionals for ongoing management and modifications. Individuals with dysphagia should work closely with a healthcare team, including physicians, speech therapists, dietitians, and nurses, to develop a comprehensive and personalized management plan. This approach helps address the specific needs of each patient and aims to improve or maintain their swallowing function and overall well-being.